Hi, I'm Claudia Campbell. I'm a professor here at Tulane School of Public Health and Tropical Medicine. I am a health economist. I went to WashU in St. Louis and actually studied macroeconomics there, and then subsequently taught at St. Louis University for 13 years before coming to Tulane. Here I teach health economics to the master's students and to the doctoral students, and then I also teach a doctoral level course in health and health research methods. I also run the Executive Doctor of Science program. I got interested in public health and healthcare when I was living in South America. I was in Dominican Republic and Uruguay with my husband, who was actually working for USAID, and learned a lot about economic development at that point and found it very interesting. Came back to the United States with him and went to Vanderbilt to get a master's degree in economic development, and then ultimately the doctorate in macroeconomics. At that time, I was still interested in health, and the whole area of health care and efficiency was emerging as really kind of a new area in terms of applying the research to that area. So that got me into the field and learned a lot about actually in process. My research as a result is really about looking at the efficiency and effectiveness of health systems, whether they're in the United States or abroad. In fact, my master's thesis was looking at Ghana and the issues around health income of women who were left in the rural areas as a result of their husbands going to the cities to engage in modernization projects. So my research then has resulted in, I've done stuff that I've looked at health insurance mechanisms and how they work, information technology and what it does to improve health systems, the shortage of physicians and practitioners and how we're going to address those, chronic disease management and the use of the ER. So those are some of the things I've looked at. When I think about my research, I think about the globalization of all of these issues and how really the problems that we face in the United States in all of these areas are really problems internationally. We're seeing as economies emerge around the world, they have to address the health system that they have. If they have enough physicians and nurses, how they're going to address new chronic diseases that are emerging, and the aging population. Since we've gotten a lot of children through childhood now, we have sort of the problems in other countries that we have in the United States. So when we look at these issues, we really need to look at them from a global perspective, and I think that's what we can do here at Tulane. I think for an aspiring a career in health and healthcare, going to a school of public health is probably the ideal setting. There are lots of programs in health management and policy that are in business schools, in medical schools, and allied health profession schools. But in a school of public health, you really get the behavioral and patient and consumer side that we don't really get sometimes in a business school setting. So when you come to a school of public health to learn about managing the health system, you're going to get the whole perspective from the patient side, the society side, the population health side, as well as the management side. Also, I think one of the lessons that we're learning now is that knowledge is growing so quickly. Our movement from the United States and public health in other countries to sort of a globalization approach to these issues means that we're always going to have to be learning and improving and going back to school, that it's a lifelong learning challenge because things are changing so rapidly. And I think this is something, again, that Tulane can do because we have a lot of folks in the field here. They're learning every day about systems around the world. And so if you come to Tulane, you can get the benefit of those broad perspectives.